Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and sometimes contradictory health information found on the internet. I want to distill all this information down to a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do the things you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Hello, and welcome to the latest episode of the Human Momentum Podcast. Some of you that have tuned in previously have almost certainly heard me refer to myself as a DO or a doctor of osteopathic medicine. So today I want to talk a little bit about what that means and something that I spent a great deal of time doing while I was in medical practice, and that is performing osteopathic manipulative medicine on individuals who were having musculoskeletal pain issues, particularly chronic lower back, chronic neck, chronic knee, hip, and foot pain. These were all things that brought a lot of business my way while I was in medical practice. And I'm personally very much a believer in osteopathic manipulation as a potential way to improve pain symptoms. And as such, I want to talk a little bit about what it is, what makes a DO different than an MD, and in what ways they're similar. And also some of the differentiations between chiropractic and osteopathic medicine, because there are some similarities there as well. And I want to talk about how you can potentially pursue finding someone who has a high degree of skill in osteopathic manipulative medicine in your area, if that's something you're interested in. Well, to start with, DOs are licensed at the same level and have the same medical and surgical practice privileges that MDs do. You will find DOs in every medical specialty, although they are more likely to be in primary care. Right now, about 11% of the physician population in the United States are DOs as opposed to MDs, and they are much more represented in primary care. About 25% of the MD population is working in primary care, and it's about 57% of the DO population. The percentage of physicians that are DOs are on the rise. When I entered medical school, there were 18 osteopathic medical colleges in the United States. That number is now up to 46. As such, 25% of the medical students currently training in the United States are training at DO schools. Osteopathic medicine started back in the early 1890s. There was a physician by the name of Andrew Taylor Still who lost his family to a cholera outbreak in the 1870s, I believe, and through a bunch of study came up with the idea of using manipulative medicine to treat disease as opposed to the way that standard medicine was approaching it at the time. To be absolutely fair to Dr. Still, who was very critical of mainstream allopathic medicine at the time, MDs were not in a great place in the late 1800s. They still didn't believe in the germ theory of disease. Sanitation after surgery was kind of a new and controversial idea. And there really weren't much in the way of medications that could have positive impact on health. Dr. Still's philosophy is something, though, that I think still has value today. He was famous for saying, and I'm paraphrasing somewhat here, that any fool could find and diagnose disease, but the job of the osteopath is to help their patients express the inherent health within themselves. The idea is that the human body is a magnificently designed thing that has the capability to maintain itself and to stay disease-free. Disease occurs when that inherent health has been impaired in some way. And the job of the osteopath is to find that. I think that this is frequently a constructive way of looking at health and disease, and that it still has a lot of value today. It was that philosophy combined with the fact that I myself was suffering from chronic shoulder and lower back pain that pulled me into DO as a profession. As I was going through my bachelor's degree, I was dealing with a lot of chronic pain issues due to prior car accidents and some falls and some other injuries. And I had been to chiropractors, been through physical therapy, and wasn't getting much in the way of long-term relief. Fortunately, I went to a graduate school fair at my university, and the Kirksville College of Osteopathic Medicine was represented there. This turned me on to the osteopathic profession. And once I saw the philosophy and heard about the potential to combine manual medicine with practice as a physician in medicine and surgery, that just immediately resonated with me. And I pursued it from then forward. I also got connected with a DO in my area who specialized in manipulative medicine. And the osteopathic manipulative interventions he used were of much more benefit to me than anything that I had pursued previously. In connecting with another OMT specializing osteopath while in medical school really got me to the point where I was fully functional again. I have fewer activity limitations now in my mid 50s than I did in my mid to late 20s. And I attribute a lot of that to the osteopathic interventions that I have received over the course of my life. Something to understand, though, is that the majority of DOs don't really use OMT, even though they've been trained in it. It's about 43% or so of the DO population that does OMT with some regularity in their practice, and less than half of those are really specializing in it and making it a large part of their practice. So it can be a little difficult to find DOs in your area that use these sort of manual interventions to help patients. I'm going to discuss towards the end of this video how to look online in a way that's meaningful to try and find DOs that do manipulative therapies in your area, if that is something that you are interested in, if you're dealing with pain issues yourself. As far as DOs versus chiropractors and what makes them different, well, first off, chiropractors are not fully licensed to practice medicine and perform surgery the way the DOs are. And because of that, DOs had had a little bit more training on that end of the spectrum. I did find that advantageous in my practice because there were a few times where I identified some significant medical issues that had been missed either by MDs or by chiropractors that were contributing to pain issues that people were coming to me for. And I think that is a significant advantage of the DO training path, is that you've had a little bit more extensive education and a little bit more rigorous examining in areas of more traditional medicine. And that can be helpful at times. As far as the treatment techniques I used, there are some that would look quite familiar to anyone who'd been to a chiropractor previously. I did use thrusting techniques, the kind of things we call high velocity, low amplitude, where you apply a very small amount of forceful thrust in a specific way to move something. And sometimes that does involve joints popping and cracking, but not always. I also used a number of treatment techniques that were quite subtle that people would sometimes wonder if I was doing anything until they saw the results after we were done treating. I had the good fortune of treating under a doctor of osteopathic medicine named William James Brooks, and he introduced me to a diagnostic paradigm that's a little different than the standard approach to diagnosis that most of us as osteopaths would get in DO school and even in residency. And this involved some ideas about how to compare motion at different joints and a very regimented way of looking at the body from head to toe to try and determine which areas were most dysfunctional. The idea is that people who develop pain who don't have any obvious structural issues that we can attribute that pain to are not going to benefit from surgery, that they're going to need some kind of intervention to improve the function of their musculoskeletal system. And figuring out where that problem is has to do with applying these principles to look at the body from head to toe and find what isn't moving the way it should. That was the idea I was left with. Now, a lot of DOs will still talk in very positional terms for diagnosis, saying that there is an elevated rib or a posterior rib or a vertebra that's rotated or a vertebra that's side slipped. That was terminology that Dr. Brooks was training me to kind of get away from. And instead, we were looking at restrictions to motion. Now, most of the DOs that will talk in positional terms will kind of interchangeably throw motion related diagnostic terms in there. It's such an elevated rib, it won't depress, that kind of thing. Dr. Brooks always thought that that was somewhat sloppy and did not lend itself well to telling where most of your problems were. Because if you're talking about an elevated rib, it's hard to compare that problem to, say, um, um, an elevated navicular bone in the foot. And what Dr. Brooks would talk about then is, well, if you talk about inferior glide of the navicular versus the elevation or depression of a rib, you then can talk about how much is that motion restricted. And by having a consciousness of where the severity of restriction is and how much, you can then begin to compare the motion of the rib to the motion of the bone in the foot, which one's worse. And that will give you some guidance as far as where to start with treatment. And that was something I found very useful through my career and made folks who had training like mine a little bit different. That's just a very nerdy way of saying that I thought I had a very effective approach to this sort of thing, and that I believe it allowed me to help people who had been treated by numerous other practitioners and hadn't gotten better. Do realize, though, that there's going to be a wide variety of approaches between different DOs. And so it's possible you went to a DO before, got the best treatment they had to offer for your problem, didn't get better. That doesn't mean that there isn't an osteopath out there that can help you. It's quite possible that a slightly different approach could be helpful. Same is true of chiropractic, same is true of massage and physical therapy. If you can find people that are doing something different, there is potential to get assistance when you haven't found it previously. I'm a big believer in general in manual medicine. I think that a large percentage of the people out there with ongoing pain issues have non-surgical issues. And that is why we see so many people who have and that is why we see so many people who have surgical intervention for pain symptoms and just don't get better. With regards to finding a DO in your area who does manipulation, the best way is to look for the American Academy of Osteopathy website. There is a section on their page that has a physician finder for a given state and given areas within a state. I'm going to include a link to that page in the description of this video. So if you're interested in finding DOs who do manipulation at a relatively high level, you can look on this page and it will point you in the right direction. Not every DO who does OMT will be on there, but the overwhelming majority who consider it a large part of their practice will be there. If you found this helpful, please do give us a like on this video and subscribe to the channel. It's very helpful in me continuing to expand this and continuing my ongoing efforts to get good medical information out to folks. Also, do feel free to share it with anyone you think could benefit from this information. Once again, hope you found this helpful, and I will see you again next time.